as far as type 2 diabetes, and I just want to make it clear that I'm going to be focusing on type 2 diabetes because that is what I do and what I am interested in. And first, I just want to walk through some incredibly basic, agreed upon things that then somehow escape even intelligent people when we move those things into guidelines, okay? And that is, type 2 diabetes is what? It's a problem of elevated blood sugar. And although humans are different, and heavens knows we need to respect the differences, we cannot utilize a one-size-fits-all approach. We do have to understand that there are some things that are the same. And again, associations like the American Diabetes Association readily acknowledge, okay, in a disease where the problem is elevated glucose, that the macronutrient that elevates glucose is carbohydrates, okay? So problem, elevated glucose, macronutrient that the American Diabetes Association acknowledges is the cause of elevated glucose, especially postprandial, which we know is a risk factor for coronary artery disease. If we want to not just manage with another pill, but reverse out of the disease process, we have to take away or significantly limit what is causing the problem. And so that's why the approach that I utilize is a low carbohydrate, and therefore, because there's 3 macronutrients, we have to balance this out, becomes a high fat diet. And we have a study that I'll be excited to talk about later that shows that this works very well. And I think that what we can say is that there are 3 ways that we can reverse out of the huge epidemic of type 2 diabetes that the entire world is facing. Okay, there are 3 proven ways to reverse this: bariatric surgery, a significantly calorie-restricted diet, and a low carbohydrate, high fat approach. There are 3 things that work. And what I would love to see is consensus that reversal should be a goal, that patients should be given the choice of which of these 3 proven methods they would like to initiate and manage in their own life. Because patient A may choose surgery, and I applaud patient A that they're going to take control and do something. Patient B may want to calorie restrict forever. Fantastic. That is great for them as well. And a lot of patients, I think majority of the patients, and again, that's just my opinion, are going to choose a non-calorie restricted method of just reducing carbohydrates. And one of the main criticisms we get is that this is not sustainable. But again, we published our 1-year data, 83% still adhering. And we actually have proof of adherence through beta-hydroxybutyrate levels, which is unlike any nutrition study in the past. We always guess at their adherence, and we use the unreliable food diaries. We can show that they adhered. And we are going to be publishing our 2-year data soon. And I will tell you, adherence is fantastic. So again, I think the most important take-home thing is people have choices. Patients with diabetes have choices. They need to be educated that the choices exist and that the goal of reversal is real. They need to be explained all 3 choices that are evidence-based, and then the patient needs to be able to be the one to take control.
Fantastic. 4 minutes. Thank you very much.
One of the things, going back to the term reversal, that makes people nervous is that they say, well, you're not curing anyone. But curing means that the disease isn't going to come back, right? Reversing is the most appropriate terminology for exactly what we're doing, because it's been widely accepted for decades now that once someone gets on the road or the path of type 2 diabetes, it is a one-way street. You are going to progress. You are going to continue to get worse. And those facts are absolutely true with standard of care management. But again, if we start hitting the root cause of the problem, the underlying insulin resistance with type 2 diabetes, then we can truly turn the one-way street into a two-way street, flip a U-turn and start to pull back. And again, that's why I think that the terminology is so incredibly appropriate for this.
I am so optimistic that treatment of diabetes is going to be revolutionized over the next 5 to 10 years. Because again, what we see is a grassroots movement. Diabetics don't want to be told that they're going to be sick for the rest of their life. And the argument people give is that no one's going to follow that diet. But wait a minute. You told someone that they have a chronic progressive disease that they will die from, but before they die, they may go blind, they may have to go on dialysis, they may lose their limbs. And you don't think that that's motivating enough for people to want to change? Because I argue it is. And what we have done is not given people a chance.
It feels like very sort of paternalistic sort of view of the world where the doctor takes that decision away from the person who's affected by it, right?
Absolutely, right. I mean, they say that people can't change. And so that's just, again, making the decision. They've made the decision before even presenting the options, right? They can't change. They wouldn't be able to stick with a low carbohydrate diet. Therefore, I'm not going to give them the opportunity to learn about that. Well, people are getting smart, and the internet and programs like yours are helping people by allowing them to understand that there is a solution. And it doesn't mean you just have to take more and more medicine. It doesn't mean that you have to, face a life with all of these comorbidities along with diabetes in your future, and you can take charge of it. And people, once they understand that and they get themselves educated, they do want to change. They want to live a more productive and healthier life. They want to feel better. People say that they can't stick with it, but I have been using this treatment for diabetics for 3 years, and I have plenty of my first patients that I still see regularly in my clinic. So I can tell you right now that that's not true. And people come in and they say, I couldn't even imagine. They take a look at a piece of bread and they say, I can't even now fathom that used to be something that I might reach for. They really do have this switch that flips in them. And it flips for many reasons. Number one, I think one of the first keys to actually having this switch flip where they are going to do this as a lifestyle is educating them. So you're not just telling them what to eat, you're helping them understand why. Then they begin to do it, and all of a sudden, they start to feel better. Their energy is better. They get up and say, I didn't hurt as much as I used to. I haven't felt this good in 20 years. Most of our diabetics are overweight. They're losing weight. That's motivating, let's face it. And then the other thing is all of a sudden, they don't have to take all their medications. And that's not only a nuisance, but that's a big saving for their pocketbook. All these things together will tell us that yes, people can stay with it. Once we get someone off of 200 units of insulin, they don't want to go back to that. They don't want to go back to that. And it's motivating every day to understand where they came from and where they are now.
Unfortunately, if we dial that back and say, when did this really start getting back? It's when we were told to put all the carbohydrates in our diet in this attempt to avoid fat.
Yeah.
So, that was really kind of a heralding moment in our nation's health history. So if we were told we couldn't eat fat, people needed to eat something. And since there's only 3 macronutrients, carbohydrates, proteins, and fats, when we dialed back the fat, we really increased the carbohydrates. Now, the important thing about restricting carbohydrates is that I didn't say restrict in general. It's restricting carbohydrates. Because one of the problems and one of the traps we've fallen into with our advice over the years is everything is eat less, exercise more. Eat less, exercise more. Calories in, calories out. And it's frustrating to patients because I want to find the person who suffers from obesity or type 2 diabetes who hasn't already tried that. People are trying that, but they get very frustrated because, again, that advice doesn't hit home at the root of the problem. So we don't have to pound away at everybody, don't eat, be hungry, but go out and exercise anyway. Instead, if we cannot have them obsessing and thinking about calories so much and instead just worry about decreasing the carbohydrates in the diet, this works, and it works fast, and people actually feel better. One of the things we have to understand is making a lifestyle change is hard. If it was easy, everybody would do it, right? But it's not. It's something that requires education and time to educate people. And then support, because everybody's different. And we can't take the business traveler and give them the same plan as someone who likes to cook every day in their home. And the solution is, again, to take the time with patients, explain to them how the physiology works, help and support them with lifestyle changes, and continue to do more research in this area so that we can understand even more how to make people successful in reversal of their type 2 diabetes. I really believe that we can change things. We can change things for people. We can help them. We just have to start giving them sensible advice.
So the solution to the diabetes epidemic in my clinic is exceedingly clear. Stop using medicine to treat food. And for a disease whose root cause is carbohydrates, take away the carbohydrates, or at least cut them, so we can remember what we used to know. We knew it a long time ago. This was said thousands of years ago, and we need, in this day and age, to get back to that notion. Thank you.